Hello Medicos, good day to all of you. This is Dr. BK for you, and today's topic is a continuation of the heart. So we have been actually describing or discussing about the heart from the past two classes. So first we have discussed about the coverings of the heart, that is the pericardium and its sinuses. So followed by that we have discussed in detail about the external features of the heart. So actually how the four chambers of the heart externally, how they appear and how they are separated from each other. So on the surface, what are all the grooves or sulci you are able to make out on the surfaces, and then various surfaces and borders of the heart and the presenting parts, the situation of the heart and how all these four chambers are oriented. We have seen all that in detail. Now we will go to the internal aspect. Okay, so in this session I will be discussing about the two upper chambers, that is the atria. So the learning objectives for today's session will be a short introduction about these atria, then followed by that a brief recap of the external features of each of the atria, that is the right and the left atria. Followed by that we are going to discuss in detail about the internal features. So internally, how actually the atria, that is both the right and the left atria, what are the features they represent and how actually they appear when we open and see the interior of these two chambers. And finally we will conclude this session with a few points on the clinical aspects. Okay. Now coming to the atria, as we all know there are right and the left atrium. Atria we call it as plural and singular is the atrium. They are actually situated somewhat posterior and behind the ventricles. So they are posterior superior to the ventricles. That is because developmentally it happens so during the formation of the cardiac loop. The primitive, what happens is the primitive heart undergoes a folding inside the pericardial cavity, and thereby the atria which was originally below moves upwards and backwards due to the folding of the heart tube. So right atrium receives mainly all the deoxygenated blood from your upper part and the lower part of your body through the two major veins, that is the superior and inferior vena cava. So apart from that, it is also going to receive the venous blood which is actually drained from the heart itself, that is through the coronary sinus. Okay, now whereas this is the case of the right atrium, the left atrium receives purely oxygenated blood from the pulmonary veins. So the blood which is actually circulated through the lungs via the pulmonary artery, then in the pulmonary plexus, what happens? The exchange of gases takes place, carbon dioxide move out and oxygen is infused into the blood circulating in the capillaries, and from there what happens is through the pulmonary veins they reach the left atrium. So right atrium deals with deoxygenated or venous blood, whereas the left atrium deals with oxygenated blood, but again we cannot call it as venous blood or arterial blood because again left atrium receives oxygenated blood from the veins, that is the pulmonary veins. So both of the atria definitely are separated by an interatrial septum. Otherwise what happens is there is going to be a mixing of the both the oxygenated and the deoxygenated blood. So interiorly or internally, both the atrial chambers are actually separated by a interatrial septum. So externally, the interatrial septum is not very much markedly visible outside. Okay, on the posterior aspect you can see a faint mark which is representing the interatrial septum, but the ventricles are separated from the atrium by the atrioventricular groove, and this can be appreciated externally to a greater extent. Okay, and internally both the chambers, the atrial chambers, communicate with the ventricular chambers through the orifice, that is the right and left atrioventricular orifice, which are guarded respectively by the tricuspid valve for the right atrioventricular orifice and the bicuspid or the mitral valve for the left atrioventricular orifice. So, even though we have discussed in the past lecture about the external features of the heart, mainly the heart as a whole we have seen, but in today's class, since we are going to deal particularly with the atrium, right and left atrium, so we will just try to understand again the recap of the external features, but which is specific to the right and the left atrium. So first, to start with the right atrium, it is somewhat roughly quadrilateral in outline and it is situated behind and above the right ventricle. It is situated behind and above the right ventricle, and it extends from the opening of superior vena cava to the opening of inferior vena cava. Okay, so from the opening of superior vena cava to the opening of inferior vena cava, that is going to be the upper and the lower limit of the right atrium. So the opening of the superior vena cava is opposite the third costal cartilage, and the opening of the inferior vena cava is actually at the level of the sixth costal cartilage. So third costal cartilage to the sixth costal cartilage is the vertical extent of the right atrium. Then if you look from the right atrium, a small projection which is actually called as the right auricle. Auricle means it is like your ear, external ear. You see the ear, external ear. So that's why it is ear shaped. You call it as the auricle. Conical projection, which is somewhat thicker than the rest of the atrium. This right auricle projects forwards and to the left side, and it covers the origin of the ascending aorta and the pulmonary trunk. Okay, so it overlaps or covers the origin or root of the ascending aorta, and the origin of the pulmonary trunk is nothing but the infundibulum. Infundibulum is the outflow tract of the right ventricle. So we will see about what is infundibulum when we deal with the internal features of the ventricles. So a small conical projection which is like the shape of ear, that is why it is actually called as the right auricle, which overlaps the roots of the ascending aorta and the infundibulum. Then here one more thing what you are able to see here is in the right atrium, corresponding with the right border of the heart, you see a groove which is called as the sulcus terminalis. Okay, so this sulcus terminalis corresponds with the right border of the heart, so which is extending again from the superior vena cava to the inferior vena cava. Okay, then you will also be able to see a faint groove here, that is the position of the interatrial septum which is present deep, which is going to separate the right atrium and the left atrium chambers, both the chambers. Here it is supposed to be a very faint groove for the interatrial septum, and this can be appreciated only posteriorly. Okay, posteriorly you have the interatrial septum. So with respect to the relations, other visceral relations, external relations of the right atrium, anteriorly it is related to the right lung and pleura. Anteriorly it is related to the anterior margin of the right lung and the pleura. So that is the anterior margin of the right lung and the mediastinal pleura. To the right side it is related to the pericardium, then phrenic nerve and pericardiophrenik vessels, and then the cardiac impression of the lung. All this is separated again by the pleura. So pericardium, pericardiophrenik vessels and phrenic nerve, and the cardiac impression of the lung forms the right side relations. Posteriorly again you are able to see the right pair of pulmonary veins. Posteriorly you see the right pair of pulmonary veins. Okay, so that is anteriorly to the right side, posteriorly. To the left we have the left atrium, which is separated by the interatrial septum, which is marked externally by a faint groove. The right atrium, you know, for the external features of that heart, contributes mainly to a very small part on the sternocostal surface. The whole of the right border of the heart, the whole of the right border of the heart, and that 1/3 of the base of the heart. So here you are able to see the 1/3 of the base of the heart. The whole base, 2/3 is actually by the left atrium, and 1/3 of the base of the heart is actually contributed by the right atrium. Okay, then it is separated from the ventricles anteriorly by the right part of atrioventricular groove, and also posteriorly by the atrioventricular groove, the posterior part of atrioventricular groove. So these are the relations of the right atrium. So now we will pass on to the internal features or the interior of right atrium. So here you can see a part of the atrium is actually cut open to visualize their features, or now you are actually seeing the interior of the right atrium. The interior of the right atrium basically is divided into two parts, an anterior rough part and a posterior smooth part. Here rough you are able to see because many ridges are present here. Anterior rough part, and then what you see is the posterior smooth part. So two parts you will be able to appreciate in the interior of the right atrium. So both the parts are actually separated by a raised margin, which is actually called as the crista terminalis. Okay, so which is actually called as the crista terminalis. Both the parts, the smooth part and the rough part, are actually separated by the crista terminalis. So both the smooth and the rough parts vary in their composition, vary in their developmental also, they differ from each other. Okay. The smooth part is actually called as the sinus venerum. The smooth part of the interior of the right ventricle is actually called as the sinus venerum, and it is developed from the right horn of sinus venosus. Okay, the smooth part is actually developed from the right horn of sinus venosus. So I will come to that after a few slides about the sinus venosus. As I told you, it is developed from the right horn of the sinus venosus. So basically now you know that the interior of the right atrium is divided into a smooth and a rough part. The smooth part is actually called as the sinus venerum. So now what you are visualizing is the smooth part or the posterior, smooth posterior part. Now what all the openings you see in the smooth posterior part is the opening of SVC. Okay, so here you are able to see the opening of the superior vena cava in upper part, and it is not guarded by a valve. If at all, you will be able to see a small tubercle here. Okay, so otherwise the opening of SVC is actually not guarded by any valve. Near to the opening of the SVC and the upper part of the crista terminalis, you have the SA node, sinoatrial node. You know what is the SA node and what is the importance of the SA node? It is actually the pacemaker of the heart. The impulses, the electrical impulses are actually generated from this point and it spreads to the whole of the myocardium, cardiac muscle. So next is the opening of the IVC or the inferior vena cava. So here you are able to see that is the opening of the IVC or the inferior vena cava. The opening of the IVC is again present in the smooth posterior part. So in the smooth posterior part, upper part you see the opening of SVC, and the lower part you see the opening of IVC. The opening of IVC is again guarded by a rudimentary valve which is actually called as the Eustachian valve. Okay, it is actually called as the Eustachian valve. Okay, if you look at the Eustachian valve, it has got a left horn and it has got a right horn. The left horn is again continuous with the limbus fossa ovalis. I will come to the limbus fossa ovalis in the septum, interatrial. This is actually the interatrial septum part. Okay, so the left horn of the IVC is continuous with the limbus fossa ovalis. The right horn of the IVC is again continuous with the lower part of crista terminalis. It is actually continuous with the lower part of crista terminalis. Okay, so that is about the rudimentary valve, which is the Eustachian valve. Eustachian valve. Next opening, you see the opening of the coronary sinus. So you are able to see the coronary sinus is the large or largest venous channel of the heart, which is going to open into the right atrium. So the opening of the coronary sinus is actually situated between the opening of the inferior vena cava and the tricuspid orifice. Okay, it is situated between, you are able to see this opening, it is situated between the IVC opening and the tricuspid orifice. So that is the opening of the coronary sinus. The opening of the coronary sinus is again guarded by a valve which is also a very rudimentary valve called as the Thebesian valve. So opening of IVC guarded by Eustachian valve. Opening of the coronary sinus is actually guarded by a Thebesian valve. So you are able to see this Thebesian valve is nothing but somewhat subdivision of this valve of the IVC. So this is again developed from the lower part of the right venous valve. Okay, it is developed from the lower part of the right venous valve. So just have it in your back of your mind, right venous valve. I will just again discuss about this after a few slides. What is this right venous valve? So it is guarded by the Thebesian valve, that is the opening of the coronary sinus. Then apart from that, what is not shown in this picture is numerous small openings you can see all along the chamber, inside this chamber, and it will be more along the septal area. They are called as venae cordis minimi or Thebesian veins. Okay, venae cordis minimi, small innominate veins they will open directly into the chamber. Okay, what opens directly into the chamber is the venae cordis minimi and the anterior cardiac veins. You can see them as small, minute openings, and this you can appreciate in all the four chambers, even in left atrium and even in both the ventricles. You can actually appreciate or you can visualize these small numerous openings, which is actually the opening of the venae cordis minimi and the anterior cardiac veins. So far we have seen about the opening of superior vena cava, opening of inferior vena cava, and opening of the coronary sinus. These are the three main structures opening into the right atrium, and you know these brings venous blood from the upper half of your body, from the lower half of your body, and also from the heart itself. Next we will actually discuss some features of the septum, interatrial septum. Interatrial septum is actually a partition which is separating the right atrium from the left atrium. So it is a single septum but which has two sides. Now we are viewing the right surface of the interatrial septum. So mainly you see a shallow oval depression which is actually called as the fossa ovalis. The fossa ovalis is formed by septum primum because interatrial septum develops by a septum which grows from above, that is actually called as the septum primum. Now what happens, suddenly the upper part of the septum disintegrates or disappears, and immediately to the right of it another septum develops and overlaps the first septum, that is called as the septum secundum. You have septum primum, then you have the septum secundum. So the lower part of the septum primum you are able to see, and upper part is overlapped by the septum secundum. The septum primum is represented as the fossa ovalis. The septum secundum lower margin you are able to see here, and that is called as the limbus fossa ovalis. The limbus fossa ovalis surrounds the upper, anterior and posterior parts but not the inferior, because the free margin here it ends, the septum secundum. The lower free margin of the septum secundum is represented as the limbus fossa ovalis, which surrounds the fossa ovalis anteriorly, superiorly and posteriorly. So in the fetal stage there is an opening which is called as the foramen ovale, through which the right atrial blood, what happens is, can go to the left atrium. Right atrial blood actually goes to the left atrium. Not only that, why actually it has to go to the left atrium? Most of the blood is from the right atrium is shunted towards the left atrium instead of going to the right ventricle, because the lungs are not functional, so there is no oxygenation of blood in the lungs in the fetal life. So that is why most of the blood which is reaching the right atrium is shunted. Shunting means taking a shortcut route, thereby directly diverting the blood into the right atrium for the systemic circulation. Okay, so that is the fossa ovalis and the limbus fossa ovalis, which represents the free edge of the septum secundum. Okay, so here you are able to see the opening of the right atrium, the smooth posterior part where you see the opening of the coronary sinus, inferior vena cava, superior vena cava. Okay, this is actually the rough part. The smooth part and rough part are separated by the crista terminalis. I told you the valve of the IVC is continuous to the right side with the lower part of crista terminalis, and here to the limbus fossa ovalis. the right side. This is the OF is the foramen ovale or the oval foramen. This is actually the right auricle. The rough part is actually the right auricle. Here you are able to see the atrioventricular orifice. Right atrioventricular orifice, which is guarded by the tricuspid valve, and that is the opening of the coronary sinus. Now we are actually going to see one area which is called as this triangular area is actually called as the triangle of Koch. So this triangle of Koch is bounded anteriorly by the septal leaflet, bounded in front by the septal leaflet, behind by the opening of coronary sinus. In front by the septal leaflet, behind by the opening of coronary sinus, and above by the tendon of Todaro. This TT, what is represented as TT, is the tendon of Todaro. Okay. So what is lodged in this triangle is the AV node or the atrioventricular node. Okay. The tendon of Todaro is a subendocardial ridge. You are able to see the raised margin below the endocardium. So that is we call it as the subendocardial ridge, which extends from the left fibrous trigone of the heart again to the opening of the inferior vena cava. So that is the extension of the tendon of Todaro. So this triangle of Koch is actually present in between the septal leaflet, opening of coronary sinus, and the tendon of Todaro. That is the triangle of Koch. Then, so we have seen about the openings in the smooth posterior part of the right atrium. Then we have discussed about the interatrial septum, mainly viewed from the right atrium, right surface, limbus fossa ovalis and the fossa ovalis. Now apart from that, you will be able to see an elevation which is actually called as the Thorax aorticus, okay, which is produced by the bulging of the non-aortic sinus, okay, non-aortic sinus, the upper anterior part of the septum. So that is your interatrial septum. On the upper anterior part of the septum, you see a bulging which is called as the Thorax aorticus. That bulging is produced by the right posterior aortic sinus or non-aortic sinus. There will be two other aortic sinus. Sinus means they are just openings near the ascending aorta. We will see that in the while we deal with the chambers of the ventricular chambers. Okay, through two sinus, left sinus and right anterior, the right and left coronary artery arises. Whereas there is one more sinus or opening through which none or no coronary artery arises, and that produces a bulge on the upper anterior part of the right atrium, upper anterior part of the right atrium on the interatrial septum, that is called as the Thorax aorticus. Okay. Then if you come to the anterior part from the crista terminalis, you can see numerous muscular ridges running forwards and to the left, and they are actually called as the musculi pectinati. Okay, they are called as the musculi pectinati or pectinate muscle. Okay, so they are mainly thick in nature as compared to the sinus venarum part, and this musculi pectinati also contribute for this formation of the right auricle. So right auricle is also made up of this muscular ridges. So this part is actually developed from the right half of the primitive atrium. So the rough anterior part is actually developed from the right half of the primitive atrium, whereas the posterior part is actually derived from the sinus venosus. It's developed from the sinus venosus. Now, here on the upper part of the opening of the superior vena cava and the crista terminalis, you have the SA node or the sinoatrial node. So near the opening of the superior vena cava and upper part of the crista terminalis, the SA node is located, which is the pacemaker of the heart. Now we will move on to the next chamber, that is the left atrium. So the left atrium is thin walled as compared to the right atrium, and it is quadrangular in shape. You see a small, very small projection compared to the right auricle. It's a very small projection, that is the left auricle, situated behind the left ventricle, okay, and to the left, behind and to the left of left ventricle. And small projection, you call it as the left auricle. So it mainly contributes to the 2/3 of the base of the heart, and also to the left border of the heart, and to some extent that auricle, small part which you have seen anteriorly, can be seen on the sternocostal surface. So contributes to the left border, auricle contributes to the left surface, and mainly the posterior part, you can see the left atrium contributes to the 2/3 of the base of the heart. To the left side, related to left lung and pleura, and between the pleura and the pericardium, you have the pericardiophrenik vessels and the phrenic nerve intervening. Posteriorly, it will be related to the oblique sinus, then pericardium, and behind that the posterior mediastinal structures, that is your bifurcation of trachea, esophagus, thoracic duct, sympathetic chain, azygos, mainly the accessory hemiazygos vein, all these will be related posterior to the left atrium, on the posterior aspect. So that is the oblique sinus you are visualizing now after the removal of the heart. So immediately behind the left atrium, you will see the oblique sinus. Coming to the interior, even this also has got a smooth posterior part and a rough anterior part. The smooth posterior part or mainly in the smooth posterior part, you can see the opening of the pulmonary veins. Two pairs of pulmonary veins. So 4 pulmonary veins, you can see this is the opening of the 4 pulmonary veins. The smooth part itself is actually developed from the absorption of single pulmonary vein, which divides into 4 absorbed part of the pulmonary vein, which is contributing for the smooth part of the your left atrium. Then muscular ridges are mainly confined to the left auricle, only in the left auricle. Same like musculi pectinati, you can see here very small muscular ridges, and they are actually developed from the primitive atrium, from the left part of the primitive atrium. So right part is actually developed from the pulmonary veins. They get absorbed into the chamber of the left atrium, whereas the rough part is actually developed from the left half of the primitive atrium. Then apart from that, numerous minute openings, which is actually called as vena cordis minimus, can be seen all along the interior of the small veins opening all along the interior of the left atrium. The left atrium communicates with the left ventricle through the bicuspid valve. It has only 2 cusps. So that is why it is called as bicuspid valve or the mitral valve. Then you are able to see the interatrial septum. In the interatrial septum, mainly what you are able to see, the fossa ovalis here, it is actually seen in the form of fossa lunata. So that side we saw the fossa ovalis, an oval depression, shallow oval fossa we have seen there on the right side formed by the septum primum. Same way here we are seeing in the form of fossa lunata, okay, from the left surface of the interatrial septum. So mainly blood from the right atrium is actually directed into the right ventricle, that is from the opening of superior and inferior vena cava, Then from here to the pulmonary trunk goes to the lungs. Through the pulmonary veins, it reaches the left atrium. Then it is entering the left ventricle and pumped into the aorta for systemic circulation. In between the atrium, the interatrial septum in the fetal life will have an opening so that all the blood is shunted directly into the left atrium instead of passing through the right ventricle, lungs and then coming this way. Because as I told you that the lungs are non-functional. So a brief development of the atria. Here you are able to see the parts of the primitive heart tube, which consist of bulbus cordis, primitive ventricle, primitive atrium and sinus venosus. The folding of the heart tube, which is called as cardiac loop formation, takes place. Thereby the atria moves posteriorly and superior to the ventricle. Posterior and superior to the ventricle. So the primitive atrium receives two horns. Two horns you are able to see. This is the right horn of sinus venosus and that is the left sinus venosus. The right horn of sinus, each horn of sinus venosus will receive three veins: vitelline vein, umbilical vein and common cardinal vein. Okay, vitelline vein from the yolk sac, umbilical vein which is coming from the umbilicus, common cardinal vein is actually the veins which is draining the fetus. Vitelline, common cardinal and the umbilical veins. Okay. The right side, what happens is, first between these two, the opening of the sinus venosus will be at the center. Slowly the opening is shifted towards the right side. Left horn of sinus venosus completely disappears. Only what is represented as the coronary sinus. The right horn of sinus venosus develops and naturally all the veins, common cardinal vein, vitelline vein, umbilical vein opens, and that is the opening of the valve of the opening of the sinus venosus, right horn of sinus venosus. So it has got an upper and a lower valve. This inferior valve only forms the opening of the IVC and the coronary sinus. The superior valve only forms the crista terminalis. Okay. So that is the orifice of sinus venosus will be guarded by these two valves. Okay. Inferior valve gets subdivided and it forms the opening of IVC and the coronary sinus and will be continuous with the lower part of crista terminalis. This upper valve, right horn's upper valve forms the crista terminalis. So that is the case of the right atrium, how the smooth part is developed. Smooth part of left atrium, you can see single pulmonary vein opening. This single vein will divide into four, thereby you have the four veins and that gets absorbed forming the smooth part of the left atrium. Interatrial septum, you are able to see first the septum primum grows towards the AV cushion here, atrioventricular cushion. Are you able to understand? So how the septum is extending and what happens is, now the upper part of the septum disappears, that is the septum primum disappears, and immediately to the right of it another septum grows downwards, that is the septum secundum. So the free margin, so upper part of septum primum disappears, lower part of septum secundum disappears. So this lower part only is seen as fossa ovalis of the septum primum. The lower free margin of septum secundum forms the limbus fossa ovalis. The rough part is actually developed from the primitive atrium, that is your musculi pectinate auricle of both the atrium are actually developed from the primitive atrium. So coming to the applied aspects, so endocarditis is infection of the endocardium of the heart, infective endocarditis. It might be due to many reasons. Inflammation also might take place. Streptococcal infections might lead to rheumatic heart pain. So they might also invade your heart. So it is called as it licks the knee and bites the heart, because first you have swelling on the knee joints, then followed by it will infect your heart. Then any thrombus, especially the right auricle where you have rough ridges, so any clot might get formed there. If that thrombus might move from the right atrium to the right ventricle, from the right ventricle through the pulmonary artery, it might go and lodge into the lungs, forming pulmonary embolism. Same way, if there is any thrombus in the left atrium, that might move into the left ventricle, systemic aorta, and from there it might go and form embolism, renal embolism, or it might form cerebral embolism to the brain. Okay, so through the systemic circulation it might reach there. Now, atrial septal defect. So if this is not closed, because once the baby is born, during the first cry what happens is both the septum will get approximated and shuts down during the first breath. Okay, if it is not shut, then you have interatrial septum, which is patent foramen ovale. So in that case what happens, there will be mixing of the atrial oxygenated and the deoxygenated blood. So the baby might appear cyanotic, blue baby. Then one more condition is actually called as probe patency of foramen ovale. In the probe patency of the foramen ovale, physiologically there is the foramen ovale is not patent, blood does not pass through. But if you attempt to probe it, then you can see the opening is still there. So anatomically there is a patent foramen, but physiologically it is not so. That is called as the probe patency of the foramen ovale. So in mitral stenosis, if there is actually hypertrophy of the left atrium, it might lead to compress the posterior mediastinal structures, where you can see left recurrent laryngeal nerve palsy. So hoarseness of voice is a symptom. Then again dysphagia, difficulty in swallowing in left atrial myxoma. Okay, but in some books, Ortner's syndrome also they tell it is dysphagia, brings about the dysphagia due to the mitral stenosis, because this will compress on the posterior mediastinal structures. So with this I have actually completed about the interior of the right and the left atrium. So in the next class we will discuss about the interior of the ventricles. Thank you very much for your patient listening.